Hello, I'm back. and it's been a little while, but however, I'm back with another video, and yes, I'm still in nursing school, and in this video I would like to discuss my first day of clinicals. I finally made it to clinicals, and it was a really good experience for me. I have enjoyed I have enjoyed my clinical experience. As a matter of fact, it seems like I'm enjoying it a bit too much. First of all, on the first day of clinicals, because it was our very first clinicals, we had to get there on time. And I myself got there extra early because I wanted to make sure I don't miss out on anything. Because it's the first day, new nurses, never been to clinicals, so of course, you know, the clinical instructor has to give some instruction to the student. So I arrived there and it was all good. We walk up to the floor, we introduce ourselves to the nurses and got to know them, and you know, each one of us went in a different direction, and we were allowed to follow the nurses and the patient care technician. Our clinical instructor asked us to help them as well, because as nurses we need to know everything that involves the patient, because sometimes as a nurse, when you become a nurse, you may not always have that help on a busy day, so we need to know how to do it all and not always rely on the tech to come and help us. So we had to work. We were limited to what we had learned in lab in school. If we hadn't learned it yet, then we're not allowed to do it. As far as like passing out meds, you know, we were new nursing students, so we hadn't gotten there yet. So that's not something that you go and start passing out meds. You know, there were limits to what we had to do, and then if you needed help, you can always ask your clinical instructor to help you, or a nurse can help you and talk you through it. My personal clinical experience was fun, and I strongly believe that a clinical experience is what you make it. If you go to the hospital on the floor and then you just stand there and then you say no to everything, of course you're not going to learn anything. But when you get there and then you're constantly asking questions, you're willing, you know, to try and have the nurse watch you do it, or have your clinical instructor watch you, then that's how you will learn. But if you don't do it, you know, you're never going to learn how to properly do it. Once you become a nurse, you're not going to know how to take care of your patients. So your clinical experience is what you make it. And I have learned not to say no when a nurse asks you to do something. Either you do it, or you ask for assistance to do it, or if you haven't learned it, you can tell her that, you know, you're not at that level yet, because saying no is a bad reflection on you and a bad reflection on your school. So all in all, the first day of clinical for me, I was very nervous, but after going into the first and second patient room, I got comfortable, and that was my clinical experience. So thank you so much for watching, and stay tuned for the next video. Bye.